Details about wearing protective masks you probably did not know and are not easily available. The mask, medical workers mask, covering your mouth and nose when you might be within 6 feet of other people, is mainly to protect others from you in case you have COVID-19 with or without symptoms. One South Korean study shows that masks do not offer complete protection from a series of coughs, which can expel 3,000 droplets at 50 miles per hour per cough. They put a petri dish about 20 centimeters, which is a little less than 8 inches from the person with a surgical mask, and then had them cough a number of times. This is kind of a worst case situation. One can read the study on the website and see it has limited application to the likely use of cloth or surgical mask, which the normal talking distance from someone is about 24 inches or 61 centimeters. Also read the peer-reviewed technical criticisms of the study. To facilitate protection for yourself, in addition to wearing a mask, some type of eyeglasses or eye shield in addition to the mask are required to protect your eyes. Your eyes are mucous membranes very vulnerable to expelled COVID droplets. If your glasses fog up due to the mask, there are many methods shown on the web to prevent fogging from happening. Face shields are possibly a step above eyeglasses and masks for protection. In an opinion piece by 3 doctors published in JAMA lists many advantages of a face shield over masks. Among others, face shields were able to reduce the immediate viral exposure by 96% when worn by a simulated healthcare worker who was 18 inches from a cough. Mask with regular glasses to protect your eyes if around people without mask, or even better, wraparound glass, which you can get at inexpensively at hardware stores. Also, face shields, 3 types shown. If you know you can easily avoid during your outing being within 6 feet of other people, like a walk in an open space, then having the mask on all the time may have some health disadvantages. A few reasons not to have the mask on all the time. When you are sure you can social distance. The most frequent problem is you are rebreathing some of your own respirated CO2, that carbon dioxide. The problems discussed in medical literature are with increased levels of CO2, carbon dioxide, because of rebreathing it, and this is called hypercapnia, when you have an imbalance of oxygen versus CO2, can lead to increased blood pressure, headaches, muscle twitches, rapid heart rate, chest pain, confusion and fatigue, and lowering your blood oxygen level. Several medical references supporting these facts are on the website shown at the end of this video. The main one comes from a study of 53 surgeons using a pulse oximeter pre- and post-operatively. It's published in the medical journal neurochirurgia. I tested my own rebreathing of CO2 when I was wearing a cotton mask by using my pulse oximeter to measure my oxygen. It was lowered by 2% from 98 to 96%, which isn't much, with 2 separate 5-minute trials. It did raise my pulse rate by +5 and +8 in the 2 trials. My pulse went from 62 to 70 in the second test. Shown is a pulse oximeter to measure your pulse and blood oxygen percent. Relatively inexpensive online and useful for a number of reasons during COVID-19 times. If you touch your cell phone to the mask, it will be contaminated. A study shows that cell phones can be 10 times dirtier than a public toilet. If you're adjusting it, you're likely contaminating your face. There are more advantages to wearing a mask when you cannot be at least 6 feet from other people than not wearing one. If your mask is cloth, be sure it is made of some breathable fabric like cotton, not nylon or polyester. The picture of the website coming up has all the information on any of these series of videos, plus much more, and the science reference. The web page can be found on the website bigagbigchem.org by clicking on the bold link in red in the middle of the page labeled Information on COVID-19 not easily available to the public. It's shown in the picture you're looking at.